I went to UNH Manchester for a master's in public health. To this day, I'm very grateful to them for letting me in. I wish I had the essay I wrote because I can't imagine what I said that said, hey, I'm a special ed teacher, haven't worked for 4 years and certainly have never touched healthcare, but I think I can do a master's. I did it, and I started to have a love of statistics, and I had a desire to publish, create, and do the research and publish those kinds of articles. Whoops, so I'm missing, oh, sorry. So while in my master's, I read To Err is Human. Are you familiar with the book? So it's the first time people start talking about medical errors. And I started focusing all my attention in my master's program on medical errors being a threat to our public health. That led me on to a doctorate at the University of Massachusetts Medical School. So while I was at the University of Massachusetts, I was put on, this is actually the campus. The hospital, their 1,000-bed hospital is first, and the school is in the back. I had lots of MDs on my committee, and I spent a lot of time learning how do hospitals improve care? How is healthcare improved? And I was given the ability to sit on all of these different committees with a lot of really well-educated people, and I was really starting to understand how healthcare was being improved. And as a graduate student, I was asked to sit in the back of the classroom and listen and learn. I listen and learn really well, but I don't stay quiet. And I kept asking questions. And what I realized is I wasn't asking questions as a budding researcher. I was asking questions as Noah's mom. And that doesn't mean that I was saying, well, when Noah was in the hospital, this happened. But I couldn't divorce myself from the patients and the family members. So when we were talking falls or readmissions or pressure ulcers, I couldn't help but ask questions about where were the families. And so I started really asking this question: where were the patients? How are we trying to improve healthcare without talking to patients and families? How are we saying, okay, let's improve antibiotic stewardship, but let's not talk to the public about it. Let's reduce falls in hospitals, but we're not talking to people who have fallen or family members of people who have fallen. So I graduated with my doctorate. Thank you. And when I came out of my PhD bubble, thinking that I was ready and I was going to transform healthcare across the continuum, I was going to become wildly famous and wealthy, I realized people as smart as me, maybe even a little smarter, had already figured out patient engagement is a blockbuster drug of the century. So if in all the areas that you all work, if somebody said, I have a pill that will change everything for the people that you serve, maybe pill is not the best thing but if we had a solution that might transform people, we would want to try to use it. And so that's what we're going to talk about today. And I'm inviting you all to jump on my bandwagon, or the PFE, Patient Family Engagement bandwagon. So there's a definition. And what I want you to think about, I'm going to use the term patient and family, but that can be consumers, that can be clients, that can be however you refer to the people that you all serve. So don't get hung up on that. It's just the language that is going to come out of my mouth. What I want you to see here is the concept of partnership at various levels across the healthcare system. And I would venture to say across the continuum. So this is behavioral health. This is substance use support. This is public health. So let's start thinking in terms of that. This is a framework that goes across the consultation, involvement, and leadership, partnership and shared leadership, then direct care, organizational design and governance, and policy making. So I'm going to start with direct care. So when we're thinking about individuals receiving care of any kind, it's been shown that if their beliefs, desires, and cultures are considered in their care plan, they're going to follow it better, which makes sense, right? If you tell me what to do, or if you partner with me what to do, I'm going to do it. And if we're able to communicate effectively with those we're serving, we're going to access care in a different way. Anybody disagree with this? It's pretty intuitive. So again, if you put yourself into this, a relationship between patient and provider is the most important to advancing healthy behaviors, right? So I want to give you a personal example of this. I am clearly overweight, right? We're not going to discuss that. You don't have to tell me I'm beautiful. I know that. I got that. I'm adorable. But you can imagine I've had providers along the way suggest I need to lose weight. I go into a brand new primary care, and the first problem is they don't have a little, do we still call them Johnnies? The little robe that fit me. It doesn't fit me. So we adapt to that by keeping my clothes on, which I think, why can't everybody keep their clothes on then if you can adapt around this? But already I'm feeling what? Uncomfortable, humiliated. What have they told me? I'm the biggest human being you've ever had in this practice. I don't really believe that, but I'm not feeling good. So being who I am, I said to the primary care nurse practitioner, here's what's going to happen is you're going to tell me I need to lose weight, but you've already humiliated me. You've already made me feel bad. Well, so she listens to it and she apologizes and she says, okay, let's talk about your weight. I'm like, go for it. Nobody's helped me in the past. Talk about it away. And she says, what has helped you? First, she tells me about her own weight loss struggle. And then she goes, what has ever helped you in the past? We talk a little bit and she says, I hear that you do well with accountability. If you have somebody to be accountable to. I'm like, interesting, I'm listening. She goes, how about we set up a series of appointments that you come and just check in with me? Well, here's what you need to know about me. I don't fail. I don't like to fail. So if I'm coming in every 2 or 3 months to do a weight check, I'm going to focus on it differently. Then she hugs me. And she's like, thank you for being honest about how you felt. Thank you for coming in. And she hugs me. Is hugging a patient always the best idea? No, I'm not suggesting we hug, but somehow she knew that would help. That was in November, 18 pounds lighter. This is 18 pounds, right? Because it's a partnership. So suddenly me being non-compliant made a difference. Here's what we're doing. Put whatever term you use, but I guarantee you are underutilizing the patients and families that you're serving, both in the direct care and what we're going to talk about. And if you came into work every day and you did a morning huddle around a big giant pile of money, anybody have that giant pile of money? Because I might look for a new job if you do. But if you sit there going, we have enough staff, resources, equipment, everything we need, what do we do with this money? I'm suggesting to you that the people that you're serving are that pile of money. And I guarantee, maybe you are using them effectively, but let's not underutilize them. These are different inpatient or techniques. I'm not going to go through all these tools. I'm going to introduce them like this because we don't have a lot of time. But I invite you, if you're interested, I have all kinds of resources and trainings on these tools. But the idea is to invite patients to tell you, I don't understand what you want me to do, or to be honest with you about why it's a struggle to do the behavior changes, the health behavior changes that you're looking for. If we look at the organization, now we're talking about having patients or consumers or clients, community members serve as advisors. Anybody doing that, having the people that you serve serving the organization. Where are you from? Granite State Independent Living. Awesome. So you have a group that comes together. How does it work?
Over 50% of our employees have a disability. We serve people with disabilities.
Okay.
And patients or consumers, whatever language we're using, that receive services from us, that is an advisory group.
An advisory group. So that's exactly what we're talking about, is that we're bringing in the people that we are serving. These are the steps. You determine the goal. So you don't just say, we want to talk to a bunch of people that we serve. We're going to meet once a month. But you determine why. What are your goals? You prepare leadership and staff. It's a new way to do business. You recruit and orient. And again, all of these things are things that I've done, and I work within the state, and I'm available to all of you to help with this. Then collaborate and sustain. So preparing the staff really is the idea that you get senior leaders embracing this, you get staff embracing it, and you break down some of the barriers of how can we talk openly about what's happening? How can we talk about the problems or issues we're having if we have people that we're serving as part of that conversation? I'll let you in a little secret. They already know what problems you have for the most part. Recruit patients. So basically what I'll say about this is bring in patients that represent the population being served. So I do some work with organizations on substance use disorder. And what I find is people are very excited to have recovering addicts as advisors. That's great, but are they your target audience? And can we consider having active addicts, if that's the right terminology, to find out and to act as advisors, to say, how are we not helping? What can we do differently? Because if somebody's in recovery already, they're no longer the active addict. I mean, they're no longer so it's really looking at not just the people who've been highly successful with your programs, but including people who are struggling with it. You give an orientation and really start to understand the expertise in the room. The number one thing I get pushback from community members is, I have no expertise in this. But we all have an expertise, right? We are all inside our own bodies, and we're the expert on our own bodies and our own mind, our belief structures, etc. So there is an expertise. And many of us have not had the experience that the people that we're serving have had, whether that's as a patient in whatever organization. And this is actually really a fun thing to do. This is changing. There are some very small studies coming out that's saying this is returning joy to the work that people do. It's reconnecting, right? Why does Anne want me to tell Noah's story? Because it reconnects us to what we're doing, right? It connects you to me, but it reconnects, like, that's right, there are stories out there. Have fun, make it interesting, and bring some joy back. These are all different ways. Now, these are very hospital-centric, but having a patient family advisor on your leadership committee, that can happen. On a governing board, have staff interviews. What better way to find out how effective somebody's going to be with the population you're serving if your senior leaders are being interviewed by them? Patient safety rounds, that's a hospital thing, but it can be done. The secret shopper, quality observer, those two are kind of connected. Have somebody sit in your waiting rooms and observe what's happening. Have somebody actually tasked, like, to observe everything that they do as they go through your programs and feed back information about what they're hearing from other patients, what they're doing. If you have any kind of review process, storytelling is probably my favorite piece of this, because again, there's a favorite quote. One of my favorite quotes is, facts bring us to knowledge, stories bring us to wisdom, right? You engage your staff when patients, the people you're serving, are telling their stories, or staff are sharing their stories. And then you want to sustain this by constantly innovating. This is an exciting time for me to see how healthcare has changed since Noah's death, how we have brought this forward, this concept, where when I was interviewing for PhD programs, they're like, because I did well in my master's, everybody said you're a very strong candidate, but you've got to stop talking about your son. So I did. I stopped being a bereaved mom. I stopped being Noah's mom, and I wanted to be taken seriously as a PhD candidate. But now, those two things people want to hear. Those two things have joined together and made me a stronger worker, a stronger advocate, etc. The world is changing. And don't do things big. Don't decide we're going to have consumers on everything that we do. Pick one small area, pick one project, one person who can come in and give you that perspective. And then as you adjust to it, spread it widely. And create that culture of engagement. As you're thinking of new initiatives, if you're wondering why something doesn't work, why the great idea you had didn't follow through, wasn't executed as well as you thought, start asking. John F. Kennedy, you can sit back and not do this, and because there are risks to it, but I think there's a lot more risks to being comfortably out of action or in action. So why would this not work in your organization? Okay, so you're all going to run home today and do it. Start it. Did you? Nope. Please.
We already have one of our consumers on our board of directors.
Great.
And so we struggle with trying to get a group of folks together.
Mm-hmm.
I work for a community mental health center.
Mm-hmm.
And so we are right now trying to figure out how to get better feedback, whether it's a patient satisfaction survey or some way to try to engage the folks that are there. We've started groups up that don't last very long. They fall apart, we try them again, but we haven't given up on it.
Good. Do you know why they're falling apart?
Sometimes it was transportation we had to figure out. It was a time of day, we've moved it several times, so we just keep working at it.
Good.
I think it is an important piece
Great.
of work that we do, but it's not an easy thing to do.
No, it's not easy, and there are barriers, and there are risks, and it's that if you've identified transportation, this is an opportunity to get really creative. Is there some way that you can provide Uber for transportation? Is there somebody who can fund something like that for you, donate something like that for you? But constantly keeping those lines of communication as to why is this not working, why and how do we do it better, and making sure that it's meaningful work, right? It's new to everybody. People aren't knocking at doors saying, let me come and tell you what's going on. And so it takes a lot of prep, having meaningful work. None of us want to come if we're just don't understand why we're here, right? That's frustrating, but good for you. And please contact me if you want to talk further about ideas. Anybody else? Please.
Hi, my name's Carol. I'm from Wilson's Health Plan, and I run the member advisory board at the health plan, and both of the
Great.
health plans have to have member advisory boards. And we struggled with the same things, getting a group, getting them to stick together. I think, one of the comments I would have is that it does take a long time. You have to give them a reason to come, and sometimes that reason is a monetary reason, a $25 gift card, along with a $100 gift basket that we raffle off. It's not much money to maybe some of us, but for them it is. It's a reason to come, and then you build the relationships with them. You show them that you care. You want to hear their voice. So this has all taken me 2 years to get 10 consistent people that are coming a couple times a year. We provide the transportation through the Medicaid funding. You might want to talk to us to see if you're inviting Medicaid folks, even though it's not an appointment, if we can maybe figure that out for you, because it's a valued visit. But, you know, I think we still struggle with, I really had to bring staff down when they would come in, so I set up an agenda, you know, let's talk about behavioral health this time. And, you know, I would have our vendor come in and talk in terms that were up here, even though I said, keep it here, make it relatable.
Right.
So that takes a lot of thought. I think I always send out questions to them beforehand. What do you want to talk about? What's not working for you? Prior authorization, pharmacy, transportation. You know, they kind of come to here. They think you're the expert, so they don't think what they have to say is
Exactly,
important.
yeah.
And that's the part when you talked about it that it's hard to dig and make them understand that you want them to talk, and then to get them to raise their hand is also difficult. So it takes time and cultivating the relationship.
Right, and I'm glad you said that. It is not, you cannot go from today to tomorrow or next Tuesday having an advisory council. It's a year, it's 2 years, it's breaking down, it's a brand new concept for the people that you're serving as well as for you. So there's a huge learning curve on both sides, figuring out what works. $25 gift card, as long as they're not so dependent on that they're not giving you honest feedback. But it's also trusting. You're asking them, come into the organization that's helping you, that's serving you, and if you criticize us, you know, there's a natural distrust. So it takes really understanding what it means to be so this is a partnership. This isn't a group that you sit down and say, okay, I've got my group here, tell me what you want to see change, but it's a partnership. So it's us, the organization, saying, okay, here's what we're working on. Does this make sense? Not the final thing, because that happens a lot. Like, here's the final blueprints. You know what that's like? Is like, I travel a lot with my husband. I do speaking engagements. We're in a hotel. I get dressed. I'm like, does this look okay? Do you think this looks okay for me to present in? He knows I didn't bring my whole wardrobe, right? So what am I actually asking him? That's beautiful. Go forth and conquer. You look terrific. People know when they're just pawns, right? Like, here's the final blueprints. What do you think? Here's our final project. They're like, okay, yep, that looks good to me. As opposed to, here's what we're thinking of doing. And how does that look? So it's really, so I'm out of time. My contact information is there. Like I said, I work within the state. We, for the foundation, we're working on a curriculum. So you're going to get a survey from Ann after this, that we're working on a curriculum that's going to be available to everybody. And I'd love your input on the survey and going forward. And if you have immediate needs, please feel free to contact me, and we can work together. Thank you.